It's your favorite podcast. It's Vanguard From Yaad, The Reckoning with Reasoning, with your host, Legendary G.
Welcome to another episode of Vanguard From Yaad, The Reckoning with Reasoning. I'm your host, Legendary G. So on this episode of Vanguard From Yaad, I sat down with a friend of mine, Dr. Vernon Lyons, who works at KPH, who gave me a devastating pictorial of the reality and effect of the COVID-19 pandemic. Since COVID hit Jamaica back in March 2020, our healthcare workers have been plunged into a reality of disarray. The only beacon of hope was and is the vaccine. But even with the vaccine, there were still challenges and pitfalls that send shockwaves throughout the health sector, creating tighter measures and also maxing out our entire oxygen reserve. Now, with over 1 million doses of vaccine administered and COVID-19 cases trending down, and the fact that we are nowhere near normalcy, what is our responsibility? I know the festive season is coming up, and we're looking forward to all the joy with our friends and loved ones. But please remember that we're still living with COVID, and that our healthcare workers needs a break from the hellish rigidity. So join me while we discuss with Dr. Lyons the reality of our healthcare workers and how can we repair the contract between doctors and patients. So welcome to Vanguard From Yaad, The Reckoning with Reasoning. And here with me today is my brethren, Dr. Vernon Lyons. Yes, yeah man, and he'll be joining us and we'll be talking about the frontline workers and what they have to endure, trying to bring out a more empathetic side towards the whole pandemic thing. Our frontline workers are, if life was a Marvel movie, they would be our superhero. Yeah, we have to appreciate that, appreciate our doctors and our practitioners and our frontline workers and stuff, yeah. So with me today is Dr. Vernon Lyons, my brethren. He has a bachelor's in physics, master's in educational psychology, and you work at what? KPH, right?
Yeah, I work at KPH.
Yes, so he's currently working at KPH, and he'll be talking about, about his experience when COVID hit and some of the stuff that really matters. So talk to me, Vernon. It's been a while, bro. We haven't seen each other, for quite some time,
Yeah.
COVID thing. I mean, really come a road like that again. So,
Yeah.
we definitely have to plan some link up.
Yeah.
Okay.
I can't wait. But yeah, first, thanks for having me on the show. Really appreciate it. Really appreciate that you're trying to get the message out and really trying to educate and inform people about what's going on for us. So thanks for having me here, man.
Most definitely, my brother.
Yeah.
Yeah, man. So talk to us. The impact of COVID and you personally and your family. Let's start there.
Okay. So COVID has had a major impact on my family and myself in how I practice medicine. In terms of how it could affect my family is that I have multiple doctors in my family. My father's a doctor, my sister's a doctor, and I'm a doctor. In terms of work, it definitely changes the way that we can work. It creates a lot more stress within us in terms of how we deliver medicine and how we can help people. For me, it was tough. It was tough, especially in this last wave that we had. Particularly, I was working on a anesthesia rotation. So anesthesia is basically the guys that they prevent your pain during surgery and put you to sleep during surgery. Yeah. Is the easiest summary for it. And then also we manage the airways of people. So especially during COVID, we became sort of the go-tos we became the go-to service for particularly patients who were having severe reactions to COVID. COVID itself, it's like for the patients that I would see for COVID, it was like watching someone drown slowly. It was difficult. I imagine like drowning is a terrible way to go. And it's because you're watching this person slowly lose the ability to breathe over time. And no matter what interventions you did, it didn't help. And we would give them the maximum that we could do. let's say right now, me and you, we're breathing oxygen, right? We're just breathing the air that's around us. There's about 20% oxygen in the air that we breathe, okay? Our first measure is to give you 100% oxygen. So that's 5 times the amount of oxygen that you have to do, that you need, that you and I are breathing right now and sitting comfortably. And these people would still be having their oxygen drop, 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 drop. Okay. Now, in a minute, let's say that you and I take 20 breaths. That's going to be about more about 2 liters of oxygen that we take in.
Yes.
What we would do first, also along with giving you 100% oxygen, was we would crank it up to 5, 10, 15 liters of oxygen per minute. And you still see the oxygen levels in the blood go down, 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 down. Remember that in a minute, you probably inhale you and I are probably inhaling about 2 liters of oxygen. I've already given them 15 liters of oxygen. And then we would add on another device that would give them about 70 liters of oxygen. And you see the oxygen level in the blood go down, 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 down. It was tough to watch this person, because they would look at you like, as they're trying to gasp for breath, and look at you like with eyes of, please help me. And the best you could do was doing nothing. And it was difficult to watch. Like, most people who are in medicine are there because they love to help people. I personally love seeing when you come in this state, and through the work that I do, you leave out in a better state than you were. Okay. It was difficult seeing it over and over and over again, of people who come in and just, you give them everything, and it just goes boom, 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 boom. I feel like you have a choice with COVID. You have to either become jaded and numb to it, or you had to absorb the hit and absorb the stress into yourself. Do whatever you need to cope with the stress. Yes. Some people, as you've heard in other places, might drink more. They might drink alone. They saw an increase in consumption of the alcohol when I talked to some of my friends. Some people just sleep more. Some people just watch more TVs. And you could see people who love medicine, who love to deliver medicine, who love to help people. You could see people in between, like the in-betweens, the doctor-to-doctor interactions, the doctor-to-nurse interactions, the nurse-to-doctor interactions. You could see the stress of this just increase and increase and increase, especially during the height of this last surge. You would see people just come in and just look beaten before we even start the day. I remember there was one shift where one of my seniors, we were having a day, and it was a relatively rough day, because she had to go on the COVID ward to deal with multiple patients. And then I was dealing with the patients who were in the ICU. And she said something, and me being me, and only the way that I think is, all right, I'm here. My job is to, one, learn and make sure that I get the best for my patients that I can. So sometimes it isn't until later that I think about how someone is talking to me. Like, you have to talk to me really out of step for me in the moment to stop and go, wait, hold up. And she said something. I was just on the path of, okay, I gotta get this done, this done, this done, this done, this done. Boom. I'm moving. We had a break later in the night, and she was like, Lyons, I'm sorry for how I was talking to you earlier. I have been struggling with this COVID thing. I used to love coming to work every day because I love what I do. I love this type of medicine that we do. But every morning I have to convince myself to come here every day now. That's what COVID has done for me. It's just now, instead of being able to see people really develop and really improve, most of the days we have to deal with, well, how many people died? Oh, man. How many machines do we have to get off the floors? It hit me like, oh, my God. Yeah, sometimes we have been talking about, like, I even caught myself, because I realized that in order to deal with it,
Yes.
I try to come in with a joy and to sort of crack a couple of little minor jokes.
Because you're a fun person, and I know that
Yeah,
personally, that when you come around, it's always this, joyous spirit. So I know it's probably difficult for you, to
yeah,
always being that, low frequency and vibration. So
yeah,
yeah,
yeah. So it's like you have to you lose that ability to those little in between jokes, those corny jokes,
yeah,
those little things that just break the tension a little bit. I realized that I was coming in low energy. I was coming in with just enough energy to maintain and get through, and not go too high and not go too low. Just try to
yes,
maintain, because if I let the process of the day take me and the lows would be so low, because what people don't see are the aftermaths.
yes,
What they don't see are the sisters who are crying their eyes out because their sister, their brother just died. They don't have to hear the wails of a son or a daughter who lost their mother. They were the one who had to go out and feed their family, and they brought COVID into their home. They don't have to deal with the guilt of that. They don't have to deal with that part of it, and either become jaded or you absorb it. And what I've seen a lot of people do is absorb it, and it comes out in other ways, and it is so tough to deal with. I actually remember this one thing, and I have a view of vaccination that we can go into at another time, but I remember this one morning. I was on a break. A patient had died that morning, and I was doing chest compressions on this person. Note that when you're doing chest compressions and you're putting oxygen in, all the stuff that's in them is flowing out all over the place. All the virus particles that were in their lungs is coming out all over the place. And so I'm just exhausted from a morning of dealing with doing CPR on a patient that I knew was going to die, and going on to the COVID ward, which requires
yes.
you to essentially put on a thin spacesuit. Is the best way. Like literally, you're covered from head to toe, and you've got this hot mask on that's just covering most of your face. You're struck.
Yes.
And it's not one of the little surgery masks. That I'm talking about, the full on N95 mask, and then you've got a mask over that. Then you've got another face shield over that, and then you've got hair covers, and you've got all the thick gowns, and then you've got shoe covers. Then you've got multiple layers of thick gloves that literally the backs of my hands are going to take a little while to recover from all the stuff that was, all the reactions that I was having to those gloves after a while. But I was on that floor for about 4 hours, seeing those patients, writing up their notes, changing their oxygen levels. I think I took down 3 machines that day. 2 of them were from patients that died and that night, and then one of them was from a patient who kept going down, stopped, and then slowly came back up, and we were able to send them back into regular medicine. So that was the only good thing of that day. But I remember this person called me, and it was this person who hadn't talked to me in like 2 years. The person goes, "Hey, can you do me a favor? Can you write me a note that says that I took the vaccine?" When I say that, I started to cuss this person. Like full on.
Yes.
Every code switching back and forth.
Yeah.
They hung up, and I was still going.
Yeah.
And I was still going. I probably went on I knew they hung up, and I went on for another 5 minutes, 5 to 10 minutes. And I'm talking about 5 to 10 minutes, knowing fully well this person's not on the phone.
Yes.
And it was at that point that I realized that I had absorbed so much of the hurt and the anger and the frustration of this thing that I didn't even know. Because I thought I had a decent day. I was just sitting there. It was the first. I'd gone in my car, turned on the air conditioner. I was just like, all right, I'm just gonna sit here for a little bit. And I didn't realize I'd had so much of it on under the surface, just sitting there waiting,
Yeah.
for somebody to cross that line and let me just unleash it all.
Yeah.
And I think a lot of it, particularly in that one, I feel like there was a break in the social contract. So for me, I think there's a social contract between doctors and the public. And the contract is, I go to school, I study this stuff meticulously, I give up a great part of my youth to make sure that I am an expert at talking to you about this, to translate this difficult to understand information to you, right? And I present you with that information in a simple way that lets you know, okay, this is the risk, this is the benefit. The risk of it is not close to what the benefit is, and this is why I think you should go with this. When she came at me about this vaccine thing, this skirting of the vaccine thing, what she hadn't realized is that when we admit the patients to the COVID wards, we track who's vaccinated and who's not.
Yes.
And when I say if I said 30 to 1 in terms of the number of people who were admitted, who were vaccinated, who were unvaccinated to those who were vaccinated, I would be underrepresenting the number of people who were unvaccinated.
Whoa.
Okay. When I say if they needed our help in the department that I was in, there was a high probability. I probably ran into 2 total in 4 months. Everybody else was unvaccinated. 2 total that were vaccinated, and about over the course of 4 months, 100 to who were unvaccinated.
Yes.
Okay, and there has been a considerable consensus, a recommendation of getting vaccinated, and so many people keep breaking that contract with me that I recommend to you based on my understanding, based on what the risk is versus the benefit of it. And I'm not even talking about people who, I'm not even talking about like an older generation. Okay, I'm not even talking about an older generation who can't go on the internet and do it themselves. I'm talking about people who are I've seen people as young as in their 20s. Life is ahead of them.
Man.
And they're gone.
Whoa.
And they're gone. And they don't get that opportunity. And that's what hurts. And that's when I take that little bit and it just absorbs and it hurts.
Yeah.
It hurts.
Yeah. I can only imagine what you guys go through. But one of my major concerns since COVID hit, because I'm an empathetic person, I care about people. My thing is, where do doctors like yourself and practitioners go for that
support,
and that serene environment where you can just breathe and say, okay, this is tough, and I think that's where you guys did your part, but where I think we failed, and when I said we, I'm talking about we and the government, is to provide that space for our frontline workers where they can go and get the help that they need to perform their job. Yeah, I think you guys need an outlet. I don't know if you have it in place, but I think you need an outlet. You understand me? Maybe one of our beautiful resources that we have on the island.
Yes. So I've been fortunate that I've been on some very great teams. Teams who communicate, who pay attention to not only themselves but the people around them, and who have seen the changes in my personality and have been like, hey, you okay? This is what's going on. And who I've had conversations with, who I've been blessed to have conversations with, who also provided their insight into what's going on and shared with me what they go through and how it has affected them and how they deal with it and how they sort of balance that, allowing yourself to care while not getting jaded, but also finding ways to not absorb the hate or not absorb the anger and the frustration of it. I haven't been able to go to a beach yet in a while. Like just that used to be that, especially when I was out in St. Anne. I that was my way to just let the stress and the everything just go. Was just walk to the beach, let my feet be in the sand, have a nice little Heineken in one hand, and just let the waves just crash in, and just imagine all the stress just flowing back out into the ocean. And that used to be my way of doing it, but I haven't really been able to do that.
And nature is the best place, the best place for you guys to just go and let nature just take away all of that for a moment, because you guys need it. That's what I'm saying, that we have beautiful resorts that you guys can go to, and it shouldn't be hard, because guess what? The other day when Olympic go on, I see persons I won't call on him. Yeah, you can. Yeah, man. free night and free. You understand? We should put things into proper perspective. I know that our frontline workers, them way in over them head with this COVID thing. Yeah? We need to put something where we send a few of them each month to just take the time. To a retreat where you have some other professionals. I'm motivated to talk to, I go through therapy and all of that stuff. I want to see that for my frontline workers, because like I said, if this was a Marvel movie, our doctors would be the superheroes. So let's not play no game, because it wasn't for our frontline workers holding stuff down. This thing would have been worse than what we think. Trust me.
As your listeners can hear, the accent is very different. I was born here but grew up in the States, so I'm used to resource abundance as opposed to the resource allocation that we have to do here, and resource management we have to do here. The balancing act that I've seen done here has amazed me every day that I go in, and the leadership from the doctors the consultants that I've been dealing with has been great. And I truly, truly appreciate the leadership that I've had here. I've been blessed to have some very, very excellent leaders who can also not only tell you what to do, but explain the reasoning behind why they're balancing each resource, and why they're going to withhold this, but they're going to proceed with this. And that has been an absolute blessing for me, and an absolute blessing for, I think, the country in terms of what they do and how they do it. It's been like I back during that crisis, during that week where they were every other day, they had to just do a little when we were going through the oxygen shortage, because remember, where is that oxygen coming from? It's coming from the tanks, it's coming from our storage. So then at the same time, now that we've run out of, now that we're so low on oxygen, we have to cut back on the number of surgeries that we do. So then now you've got surgeons who know that for certain disease processes, if we get it out now, it's better than if we get it out later, but we don't have the oxygen that we need to be able to properly manage the patient during the surgery, and finding that balance and working together to make sure that we find the balance of trying to get as many surgeries done safely as properly as we could with low resource that we had in terms of oxygen that we need to divert to other people. And I think that's one of the consequences of COVID that I don't think people who are outside of medicine think about. That in order to save your family member, we have to use so many resources for your family member that it takes away from our ability to save this other person from long-term effects or to reduce the long-term effects on another person who has a different disease of some type that we can address immediately. It's been tough. Luckily, in the last few weeks, the numbers have, as far as I've seen, have been going down slowly.
Great. Yes.
It does not mean that COVID is done. It's not done.
Definitely.
It's not done. You can see internationally, and just with the way that it's mutating and how it's getting here is something that I think we need to address in the future.
Yes, about the vaccination rate, because I see 1 million doses has been
Yeah.
administered. What's your thought on that? Because before, when all this was happening, that we not take the vaccine, blah 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 blah. I know Jamaicans more than anybody else. We know, so we love talk sometimes, but when it comes down to the reality of situation, say we are tender at heart. No matter how we big and boisterous, when it comes down to certain reality, we come to self and realize that, well, this is the best option to take. So we have administered 1 million doses. What's your take on that?
We need more. My take on that is there's battles to come. We need to get as many people protected as possible. I always tell my patients who are, because what keeps happening recently for me has been, I've gone, so you're unvaccinated. Why are you unvaccinated? Oh, doc, I have like everyone, like this is how I know that they've been watching different news stations. They don't say I have pressure, or I have sugar, or I have asthma, or anything like that. They say I have comorbidities. And that's how I know that they've been watching news. They've been watching different news stations. They've been watching YouTube. They've been watching all this different stuff. When they say, they don't go, when I hear I have comorbidities, I go, oh, okay. Which non-medical professional are you listening to?
Yeah.
I was like, oh boy.
Oh my God.
Because I know that if I go, you have comorbidities to a patient, they're gonna look at me like, what? And then I have to explain to them what comorbidities is.
Definitely.
So I know if they're just throwing out comorbidities as just one word and that's it. And if I go, I stopped because I started to get a headache. I'd go, so what's a comorbidity? that was a mistake. That was a mistake.
Oh my God.
But I had to just stop and go, listen, the diseases that you have, yes, you do have other comorbidities, which are these long-term illnesses that can affect you on how you react to it. But here's the thing, depending on the type, they either give you a weakened version of the virus, or they give you a piece of coding material that causes the production of a protein that's similar to the virus, so that your body now knows, if I see this, kill it. If I see this, and when the virus comes into your body, it sees it and goes, oh, hey, I was expecting you. Hold on, let me go get something back here. And they go after it, And it benefits those with comorbidities the most for it because what a comorbidity means is that your body is already under a challenge. Your body, your all of your systems are already under a challenge. This virus is going to come in and present another challenge. And since you're already under a challenge, this challenge that the virus is going to have for you is going to be even harder to fight. Now, unless you're prepared. Now, if your body's prepared and sees, oh, I know this code. Hold on, let me go get my axe real quick, and starts chopping at it right away. You have a better chance of surviving than if your body sees that virus and goes, I know I'm on the challenge, but what's this? This virus is, okay, so it's and it's looking at it, and it's looking at it different ways, and all this time that it's looking at it this different ways, that virus is replicating and attacking your body. And it goes, oh, hey, I should probably start attacking this thing now. And it's done so much damage to your body already that now you're already under an initial challenge from your comorbidity, and you're now trying to mount an attack against something that's already been beating you up. So it gets even harder to treat that illness for you. That's why I personally try to recommend that patients with comorbidities such as pressure, sugar, asthma, sickle cell, all of those long-term illnesses that they have to take medication for daily, that they get the vaccine. Okay? I am not the dictator of your life. This is my recommendation.
Yes.
Do your research. Come in. We can discuss the research.
Definitely.
I can talk to you about how it would apply to you. How this research. Oh, doc, I saw this at this. Okay, this is what the paper was saying. It was saying that yes, some people do have a reaction, but it's 5 people. I think the back when Sweden had initially rolled out its vaccination, they were saying like it's been linked to blood clots.
Yes, I remember that time.
There were like 5 people of 100,000 people.
Whoa.
And they were like, what I start to teach some of my patients is association and causation are not the same thing.
Yeah.
Just because they happen in the same time does not mean that one caused the other.
I think the media fail us a lot during COVID, though. You know, with amplifying the negative more so than the positive, and I think that's a problem.
Here's been the difficult balance that I see with the media is the shock value to get people to listen. If I can't shock you into listening, you're gonna like most people. There are all kinds of studies that most people they don't even read past the first line of an article. They just read the headline and they read the first 2 lines and they think they know the article. And they'll tell you that I'll tell you the whole thing of what happened in the article. And I've seen it happen in my practice when people have come in and been like, Doc, this medicine article said that this. And I'm like, but did you read the article?
Exactly.
Did you read this part down there where it says that it's not related to it? Did you read this part where it said it helps you in the short term? Did you read this article where it said that if that 80% of the people who require excessive care, not just hospitalization, but extra care in terms of when I talked about putting on the extra machine that's putting on like 70 liters of oxygen, those people who need intubations, which is sticking the tube down their throat and then we breathe for them and with a ventilator, that most of the people who require those, where it's like 80% of those people are unvaccinated. Most of the others is like people who are partially vaccinated. So I struggle sometimes because of this disease. There's been an increase in the number of patients. So my time with individuals needs to be, because I have so many others that
so it's limited.
But at the same time, I have to stop and clarify so many misconceptions. And I think that is part of the problem. There are people who claim to be experts who aren't experts.
Definitely.
Even me, I make sure that I present my recommendations within the context of my training, in the context of what my goals are for you and my goals are for the population as a whole. And that has been the difficulty of it. And I don't dress it up as something sexy and make it shock value or anything like that. So
you keep it real.
So it doesn't always sink in right away. Unfortunately, what some of these people also do is they'll engage the emotion with their lie. And the hardest thing to do is the hardest lie to get someone to stop believing is one that's emotionally linked. It is so hard. Even when you present, oh God,
Especially Jamaicans, bro. We know when we get emotionally, everything come with it, you know. So,
even when you present the logic and they go, yes, that makes sense. That makes sense. That makes sense. And you wait that beat and you hear that, but. And then you just erase all that work you did. Just it's like,
oh my God. What I want to say, it is very important that we have a relationship with our doctors, so we can have conversations. And I think that that's what there was a big gap because we weren't having the conversation. And like you said, you were so busy tending to critical situations that you never get a chance to. We can help break things down. There wasn't that time, but. Now, I think we can, and I would want to hear your view in terms of, from the experience, how do we move forward in a way where we act with solidarity in terms of, patients and doctors? How can we just have a cohesive relationship where we don't go off the rails? Because we need each other to move
Absolutely.
the nation forward. So
Absolutely.
from your experience, tell me, what are some of the stuff we can do moving forward to have a better relationship?
Okay, big picture down to little picture. So big picture, I think what the government and what I think media personalities can do is try to get a cultural shift in our health seeking behaviors. So what I mean by that is that there are a lot of people who they don't know where their nearest clinic is because they only go to the emergency room when they need it, when they feel something, when my chest is hurting, when I'm short of breath, when I'm coughing and it's not stopping. That's the only time that they go to do health seeking behaviors. So I'm talking about encouraging people to go to their local clinic and get their checkups, because we can live longer, healthier lives if we do the yearly checkups. If we can get more people to do the yearly checkups. I can't tell you how many people who come into the emergency room and I'm like, so hey, what's your nearest health center? And they're like, maybe Windward or maybe I don't know. I don't know. I live Windward Road. I think that's the closest. Yeah, something like that. They and you'll ask, so when was the last time you went there? And they'll be like, I've never been there. And a lot of the comorbidities can be helped by literally just doing your
regular checkups.
Doing your regular checkups. And by doing the regular checkups, when your body is challenged by these random so influenza, corona, these viruses that mutate over the course of time and create a big challenge, the public in general is better equipped to handle it. That's what I think on the bigger level of trying to encourage more health-seeking behavior, not just when you feel sick, but something to help make sure that we maintain our health. Because especially with our history, with men of African descent who came here through the triangle trade, whose ancestors came here through the triangle trade, who had to work through the fields, and then we wonder why so many of our parents and so many of our generation actually have high blood pressure. That's part of it. And blood pressure is a thing that it's a silent killer. You don't always see it until it's too late.
Yes.
You don't always see it until your kidneys are failing or your heart is failing or you're having a stroke. And that is why that's what I want to also encourage people. Just even when you're feeling fine, go get your checkup. They'll get you on a rotation. Be like, okay, you're good. We don't have to see you for another year. Okay, you've done your blood work. You've done this. Okay, we don't have to see you for another year. Oh, hey, this is a little off. Let's do another little test.
Yes.
Oh, hey, we're able to address this early in this development, and you're able to live a much healthier life than oh man, I feel there's something going on in my stomach. Oh, this thing is spread to XYZ part of your body. And
it's good to know. Definitely.
Exactly.
Good to know.
Absolutely. So that is on the big level. On the personal level is, I think, trying to repair the contract, trying to repair the doctor-patient contract. I think there was a time when it was more of a the doctor tells you what to do and you do it and that's it. Those days are gone. Now it's more of a we're working together for your health kind of environment that's being taught to our doctors, and that's also that I hope is being encouraged by or is being felt by the community as well. We're trying to make sure that we're having that conversation like, hey doc, when I take this medication I get a headache, or when I take this medication I feel dizzy. Talk to us.
Be more transparent.
Exactly. Why I don't have the money to do this. Oh, okay. Well, let me try to work a different angle to make sure that you get the help that you need to get the best outcome you have.
Yes.
We're working together for your health. That's where we as individuals can work on it. Me as a doctor, me as a patient, just making sure that, oh, hey doc, I was hearing this article the other day about this. This is what I got from it. I can't tell you how many times I've heard that, and I've just been like, hey, no, this is what it is. This, and this. And they walk out and go, oh, all right, thanks. And then the next time I see them, those people in general have done better health seeking behaviors when I see them again. They're like, hey, thanks for explaining it this way.
Yes.
And what I've noticed sometimes, it's not always what you say, it's when you say it in someone's life. And sometimes I know that the doctors that are ahead of me have said this to a person over and over and over again. And I was just there. I was just lucky enough to be there at the right time for them to understand the message and receive the message and move forward. Because I've had the same thing where I told someone something, and then they go to another doctor and they're saying, no one told me that. And I'm like, and I look in the doc and I'm like, I have it written here. I told you. I remember the conversation we had. You were wearing a blue shirt. You were sitting right there. And
oh
like,
my God.
And they're like, no one ever told me this. I'm like, I have it written right here that I told you. You were wearing a blue shirt on this day.
Your receipt.
I have full receipts that I know you got. And accepting that. And that was also for me accepting that sometimes it's not always what you say, it's also for that person when you say to them, because they're ready to receive it. So encouraging the community to be ready to receive the information that we're also trying to deliver. Okay. And encouraging them to, yes, we will straighten out any misconceptions you have. It might be in a rush because, Jamaicans are boisterous. So if you've been in the clinic and people start waiting a little longer, you start hearing hey, some of there since 9 o'clock.
You definitely.
There since 9. You there since 9, but there since 6:30. We are chat, and so you start writing a little faster, trying to be like, okay, so you do this and you do this.
Yeah.
But at the same time, I still have responsibility to that person sitting right in front of me.
Yes.
So I try to. So we still try to make sure that we get as much of it clarified as possible, and as quick a time as we can. So that's what I think is. Those are the two things I think we can do on the bigger level: is encouraging better health-seeking behaviors from everybody, whether you're sick, whether you're feeling sick that day, or whether you're feeling healthy. One day a year can save you many days in the hospital later on. It has been the way that I've tried to trade it off for my patients when I try to encourage them to do better health-seeking behavior. And then repairing that contract. Repairing the contract, not just from us to you, but from you to us, in terms of being understanding while you're in the waiting room. Being receptive to the message we're trying to deliver to you. Actually communicating to us your challenges that you have in accepting the information and having a proper discussion for your health. And I think those are the two major things I think we can really use to improve medicine within Jamaica and moving forward. I love this place. This is the place of my birth, and there are things I want to see improve in it, and I want to see the people shine, not just here but worldwide. So
well, sir, Dr. Vernon Lyons, thank you very much, sir. And trust me, I don't have a lot of questions because you just go, you lived it, you've seen it, you understand, and you've got the experience. So it was, beautifully done, and we get an understanding. And I just want to say condolences to all those, family members who lost a loved one during COVID. I know it's very stressful. You never get a chance to send off your loved ones properly because of the whole lockdown and stuff, and the days you get to do the funeral, no wake and stuff like that. So I just want to say, heartfelt, empathy to those people and sympathy to those people. So Dr. Vernon Lyons, Bachelor in Physics and Masters in Educational Psychology, and he works at KPH, and he, giving us his experience and the reality of what it takes the frontline workers to save our lives and treat us and give up themselves to make sure that we are okay. So we have to do better, be more transparent, as him said, fix that contract between patients and doctors and stuff like that. And moving forward, we have we can do better. We can check up on ourselves. Even myself, I can do more checks on myself. So I'm not taking me out of the equation. So people. So it's just to have a better life going forward. Us Jamaicans living better, and doing well for overall community. So Dr. Lyons, sir, thank you very much again, sir. And it was, yes, man. So anytime, sir, I'll be calling up on you again. So don't feel like this is a one-time thing, it's a pass-through. So
hey, man, I'd be glad to be on. No problem. No problem.
Yes, my brother. So, thanks again. And thanks for joining me on this beautiful conversation.
All right, man. Blessings.
Every time, bro. Yes, man. Thanks for watching. Join me next week for another exciting episode. Please remember to subscribe, like, and share. Let's build this community.